Hey guys, Dr. Pelto here. I'm going to go over a little bit today. Actually, this is a presentation I'm doing for a good friend of mine, Cindy Pezza. And thank you, Cindy, for inviting me to do this. This is going to be on patient presentations, and this is going to be for your audience. And we're going to talk a little bit about this. I'm kind of passionate about it. I'll tell you a little bit of the backstory. If you're a doctor watching this, you may be thinking, well, patient presentations, isn't that where I presented to the attending when I was in school? And that just means how we learn in medical school, presenting about a patient. This is a little bit different. We're going to talk about technology, ways to increase efficiency, patient satisfaction, and bottom line. So let's get right into it. What's the real problem? Well, the real problem is that explanations are very complex with patients. And especially, let's take something real simple that we do all the time, like plantar fasciitis for podiatrists. There's so many different types of treatments for that, and it becomes complex, not just the first time that someone's seeing you, but if they come back like for the fifth or the sixth time, it can be a challenge and cause frustration. There's too many treatment options just for that one diagnosis, for example, and then we have limited time, and that's really the main thing. If you start and you see a patient, let's say you're seeing multiple plantar fasciitis patients in a day, and if you do a presentation or if you talk to them about it, you look at the x-rays, you'll watch them walk, you'll do all those types of things. But ultimately, you give them the amount of time that you have, don't you? If you got 5 minutes, they're going to get the 5-minute explanation. If you have 30 minutes, you're going to get the 30-minute explanation. And if you really want to give them the amount of time they deserve, you're always going to be running late. And that's the real problem. That's kind of how I came up with this idea of patient presentations. And what makes it worse is the fear of litigation. So if you don't have everything documented the right way, if you don't go into everything in the right way, it can be a challenge. You have some needs. You have to get good reviews, meaning patients have to like you when they're being seen by you, and you have to try to finish all of this while you're doing documentation in the treatment room. Okay, how do you do all of that? I'm going to give you guys an idea that's been working for me, might work for you. I'll tell you a little bit about it. So I always thought there has to be a better way, and this is something that I've learned throughout the years in something called strategic coach. And you take something that's frustrating and you kind of try to find a way to fix it. And there has to be a better way, and that's where these patient presentations, and actually if you want to go into it, really the background for me is I had a patient that didn't have such a good outcome, and I didn't or it was a claim that I didn't go over things with them. And I don't know if it was just a snafu of how things were scheduled. I usually do a pre-surgical visit with patients where I go over all the details, but in this case, she signed the consent and she didn't remember it, and I was thinking, gosh, that was bad, and it was caused a lot of stress and things like that. And I said, there's got to be a better way. And I was thinking, well, if I could do it over, what would I do different? Okay. And I thought, well, I would give a standard presentation every time I'm doing surgery. So the first presentation I ever did was it's a pre-surgical discussion. And I'll tell you a little bit later if you guys want to get copies of that. It was a pre-surgical discussion where I go over all the details. Actually, I'm going to pull this down for a second. I'm going to show you where it's at. So basically under patient presentations, it's up in my little browser. I have a little one here on surgery. Now this is the newer version. There's an older version that I used to have. And I pull this up when the patient is in the treatment room, and it's right on Google Slides in every one of my treatment rooms. And I kind of go over this, and it talks about different types of complication risks. It talks about, it reminds me to check my drug monitoring. It talks about pain medications. And it talks about all this stuff, the reasons for surgery, things like that. I'm not going to go into detail. You guys can look at this later. But that was the whole thing with my patients, is I needed a way to do it systematically. And that was the first presentation I ever did. And I started to really like it. So every patient, they had this presentation. It took me a little bit longer. And I'll kind of get into how things have changed. But like that was a practice changer. And then the other thing I learned in this coaching thing, it's called like you take what's working. It's like a positive focus, why it's working, and what can you do to multiply it. And then I thought, well, heck, if it's working so good in my surgery, could I do it, for example, for plantar fasciitis or for other types of things? So that's how it kind of moved into other types of treatments. So imagine this. You go see a patient in the treatment room, and they have plantar fasciitis, and you're able to ask them initial questions, watch them walk, and then you pull up a presentation. I'm going to show you this presentation. I'm not going to go through the whole thing, but I'm going to show you that's what you can do. And then not only that, you can send them a link to the presentation. You can send them a copy of a book that was made from the presentation. You can send them a video of it. You can ask for an online review. You can, do all these things. And in the conversation I get from patients is they say, Don, no one has been so prepared for my visit. Like they're wow, they're astounded because you're like the most prepared doctor. And really, we're saying the same things over and over. It's just you take time to put it into a Google Slides or a PowerPoint, and that's the main difference. So that's what we can do, and that's the power of these presentations. And really, the benefits, in my opinion, it kind of gives you excitement, especially when you see someone. In the past, when I saw like all these plantar fasciitis, I'm like, oh, I have to see another one because they're complex. Or if they come back for the 4th or 5th time, I'm going to give you a great tip about using a checklist. And then it can reduce overwhelm as well. And I'll kind of explain some tips of that. And one way is you can record your presentation and actually have them watch it when they're with you. It's easy to do. It's fun. And the cool thing is it's always getting better. This is the part that I like the most. So when I'm seeing patients, I have the presentation up. And if I see something I want to improve on, I add it in. Like we were at a recent conference and I'm going to change kind of the way I'm explaining about doing like a foot massage instead of and taking out some short foot exercises and things like that. And it uses really technology to improve patient care and saves you time. So let's get into it. Patient presentations, that's what I call it. It's basically just PowerPoints. So this is how I get to it. Like I showed you before, you go to your browser, you pull up the one on plantar fasciitis, and or you can get it through your medical record. We use Athena. And I put it right under Patient Education Genius, and you can scroll and pick the slides through that. And either way, however you want that. I think it's quicker to use a Google, this browser. Just go right at the top of your browser, pick all the presentations, and I'll show you guys how you can get a link to all these if you want to look at them. So as you can see, I've made them for a lot of different things. Not all of them are perfect. I want to be clear. I use based on like the 80-20 rule. The ones I use most are Achilles tendonitis and plantar fasciitis, and maybe nail fungus. The other ones I'll use once in a while. It really depends on my need, but I've kind of developing them over time for other things. And so this is the example of the current one I'm using for plantar fasciitis. I'm not going to go through the whole thing. I'm going to go through the first portion and I'll explain why. So I'll talk about plantar fasciitis. I'll say, Mrs. Jones, this is where your heel pain hurts. I ask how long they've had symptoms. What treatments have you tried? You all do this. How does this impact your life? I think that's a big key. Like, why now and not 3 months ago? Like, what are their goals? And I'm going to explain what we're going to go over. And I explain plantar fasciitis, how it's pulling on the Achilles, and I explain the fascia. These are just pictures that I found. I say, we got an x-ray today. And what I usually say is, the next visit, I'll probably get an ultrasound. And I explain the difference between normal thickness and a thicker fascia. This is how all of my plantar fasciitis get diagnostic ultrasound. And I say, I'm going to compare your foot and then the bad foot and the good foot. That's a real big key right there. And another thing is when they come in for the ultrasound, I added this slide, but I actually show them this slide because no one ever knows what they're looking at on the ultrasound. So I have a normal thickness and a real thick one, and I'll explain this and I'll explain the measurement. So I'll measure it and I'll share that their like right foot is thicker than the left foot. That's a real key. So the slides I use for diagnostic ultrasound are in there as well. Then I'll go over the treatment options. You can ignore it. You can do conservative treatment or you can do surgery. This I got from Chris Bromley. That was his idea. And so as I do things, I add it. And I got this from someone else as well. Basically, if it's under 3 months, it'll take about a month. If it's over 3 months, probably be 3 months. Those are just general numbers because people want to know how long it takes. And then I talk about the process, reducing pain, controlling load, repairing injured tissue. And then I come to this. Now, this is the workhorse. This is called my checklist. Now, you may or may not agree with this, but the way I explain it is I can get about 90% of my patients, 99% better with these things. And it's a matter of what order we're going to use them. Okay. So this is my checklist. And so I say, hey, Mrs. Jones, we're going to do this, this, and this. Sorry, what do you think about that? Or, I go over the different options. Now, this is where I stop. Now, let me explain something. What I used to do is I used to go through the other 15 slides. I don't do that anymore. I sometimes don't even do this because I've recorded all of these, and I'll give you guys a link if you want to go see it on my website. But I actually have an iPad where they have a little iPad, and I put it in their hand, and they're watching this presentation as I'm documenting. So as I'm doing the X-ray findings, as I'm doing other things like that, that's when I do that. Okay, so I do it now. They're watching the video, and then I'm there. then I'm doing my documentation. So that's a cool thing you could do as well. You could record these or you can use my recordings. I'm going to quickly go through these other ones. These are all included in the video where I talk about home treatments, icing, deep tissue massage, night splint, stuff like that. Doctor-specific treatments. I talk about shockwave, orthotics, Graston, a velocity brace, things that you all do, different types of injections, amnio injections, and then some of the advanced treatments. Then I have the checklist again. Now, I kind of, what I learned from Cindy, or what I've learned from a lot of different people, I remember Ben Weaver, I remember the people at the AAPPM, we talked about protocols. And so what I've added to these, not all of them, just some of them, the ones that I'm doing, is I added protocols. So basically after the checklist, you're going to see protocols for the first visit. So this is just a thought. I don't really show this to patients, but if it might help some people. So I have here X-ray, ultrasound, cortisone. With the way I kind of explain it, if your pain level is 8, 9, or 10 on a visual analog scale, I'll do cortisone. Otherwise, they'll try these other things first. Once again, walking boot. I just made it simple. Additional visits, ultrasound, shockwave, physical therapy, the braces, custom orthotics, and then advanced treatments where I put in the amnio, the PRP, the ankle foot orthotic, and the surgery. So I've included these, not in all of them yet, but I'd like to know, if they're helpful. That's what I've included. So that is the whole idea of this. Now we're going to go now into how do you make these. I'm including, well, if you go to Podiatry Practice Mastery, it's for now anyway, it's free. It's not going to be free forever. So I would join and you can get a slide developer. And this is something that I put together just to make it easier for you to make your own. You can steal mine or use mine, I guess. You can steal them, but it's actually better if you make your own. I think at least a couple of them. So this is what I did for plantar fasciitis. Basically, I talk about, well, what's working really well, what's not working or causing frustration, any improvement ideas, how do I explain the condition, like an analogy, diagnostic exams, treatments, in-office dispensing, durable medical equipment, what can I do to add value, and what takeaway can they have, and then any improvement ideas. So I did this with plantar fasciitis recently, and so what's working, shockwave's working, ultrasound, orthotics, gait exam. What's not working, when there's a lot of visits, like it gets complex. Okay, or when there's money concerns. So that's where and from this I made that that checklist because of this. Improvements, more ultrasound. Once again, putting that ultrasound slide in there has greatly increased my ultrasound. Checklist greatly simplify things. Improving the presentation, recording the presentation saved me a lot of time. Showing the anatomy, proximal tightness, different examples. Diagnostic exams, you guys all do these things as well, okay? And then improvement ideas. So I'm going to include that within the membership there. You can get a copy of this thing to do your own. Another thing that I do, I keep this in my pocket. I actually have it right here. This is the foot treatment checklist. Okay. I'm on this is version 2. This was my initial version. So another thing is, if you guys are entrepreneurs and working on things, version 1 is never perfect. Always version 2 or version 3. So this is version 1, diagnosis, different things for treatments, when their next appointment would be. I was going to put a checklist here that they would check what they're doing, but no one ever used it. And so here is the current rendition with my adjustments. I want to put these in a different order. I want to add more details for patients. But these are the main things I use for musculoskeletal things. Okay, so you can maybe you can read my chicken scratches, but that'll be rendition 2 of this. Then another thing I do within our medical record, we use something called Patient Education Genius. So I can link to it. I go up to the medical record and I can link to this and I can share information. Now, I'm actually doing it a little bit different now. Instead of sharing all these resources, I found that it was overwhelming and no one ever listened or watched it. So what I do now is on my blog. If you want to go to my blog, it's drpelto.com. I have, I put them all in one place. So I call it courses. It's just a way to put everything in one position. And then the course on plantar fasciitis. It's just one web page with everything in it. So it's the course. And on this web page, they can get my book, my quick start guide, resources. And then these are just different videos that I've recorded. This is the actual video that I have them watch in the office. Okay, here's a foam rolling video, a morning routine video that we recorded with my partner, Dr. Feldman. information about shockwave and amnio and things like that. Now, if you want to see the presentations, you just go to drpelto.com/presentation. Presentation, not presentation. Oops, it's presentations with an S. And what you'll see, these are the same ones. I just put a link to this on my iPad. And so when I go into the treatment room, I know they have plantar fasciitis. I'll give them this and I'll open it full screen and I'll hit play. And it's an 11-minute video that they can watch, and I can go do the notes. And when I finish the notes, I can go see another patient. Then I can come back. So I have these on Achilles tendonitis, my pre-surgical discussion, toenail fungus, plantar plates, forefoot pain, hallux rigidus, midfoot arthritis. I don't use all of these. I want to be very frank. The ones I use the most are up top, plantar fasciitis and Achilles tendonitis. Okay. So continue on. So now I just put one link here. Now this is called Patient Education Genius, and I send it to them. What they get is this thing, a beautiful picture of me, along with these patient education resources right here. And they click the message and they can see those resources. And it looks like this. You have 2 education resources. They can click those. The cool thing about Patient Education Genius is I think it's only $100 a month or around. I don't know how much it'll be when you guys watch this. But it pops up this chat bot. This is the best thing. Did you have a good experience? Yes. If you did, send us an online review. That is worth its gold. Okay, that's how we get so many online reviews. These are my current numbers. So Google reviews, 295, and then I think this is health grades, 113. And basically it alternates who it sends it to. And then our office has a ton more as well. So what are the benefits? Reduced liability. That's in terms of the pre-surgical discussion. Also, when you're going through these and watch the videos, you can document that in your medical record. So patient spent 20 minutes watching, I reviewed with Google Slides as well. They watched this video. That's cool. It slows and focuses your patient visit. Okay. And I just determined some patients I do the whole presentation. Other ones I have them watch the video. Other patients I'll do part of the presentation and say, hey, I'd like you to watch a copy, watch a portion of this video. Some I just give handouts. You can do it anywhere. That's the cool thing. It's PowerPoint, so you can, even if you're visiting someone and they have a foot prop, you can go through it. It can increase referrals and online recommendations. And it's more comprehensive. Because of it, I do a lot more ultrasound. And on that list, you saw a walking boot. I don't do a ton of walking boots for plantar fasciitis, but patients ask me. They're like, hey, I haven't done an orthotic. I haven't done a velocity brace or something like that. It can increase referrals. I have a way within Patient Education Genius. I ask them to send people increased vascular studies and amnio and stuff like that. They can understand it better. So the main questions I get are, do I have time? Okay. You have to make them. Once they're done, I would start with one diagnosis and just practice it. So take the pre-surgical discussion. You see them, you go through the slides, tweak your slides to be your own, do it. Or plantar fasciitis. Do the slides, try it, see how it goes, practice showing it to someone else, and then see how long it takes you. If it takes you a long time, then what you can do is you can just use that video. You start it and watch. Now, it took me a long time to have the courage to actually make someone watch the video. Okay. But there are a couple docs around here. Teresa Bertoff, she does it. And as well, I think Scott, Dr. Aronson, he does it around here. They had these little things. This is how I learned it from them. Is for surgery, they made them watch a little pre-surgical video on an iPad. And I'm like, if they can do that for pre-surgical discussion, maybe I can do it for these other things. And that's how I'm using it. And even if I don't have them watch it, I send them a copy of it. What happens if you don't have a computer in each room? Well, just as easy, you can do it with an iPad. Just get one iPad. You would have the presentations up top, and then you would have the actual videos. I don't know how to make these. Well, for now, you guys can steal these until I start charging for them. I'm not sure how much I'm going to charge, but they'll eventually be charged for them. It took me a lot of work. Okay. And basically, because I just keep tweaking them. So I want to go into part 2 quickly. I'm not going to go too much into detail here, but I just want to kind of thinking out of the box. So take those actual PowerPoints and you can record them into a video. So I recorded a video. This is one on plantar fasciitis. I used to go to a studio here in town, just so you know, there's like public access, and they gave me a free program and I just recorded my presentations there. That's an easy way. Even easier though now, I use currently StreamYard, or you can use Zoom and you can record them. That's real easy. You can use them in the treatment rooms. These are the actual ones I just showed you guys. They're there. You can use them for an email blast. So you can take the same one and you can send it out in an email. This is a newsletter we talk. So we do this for our monthly newsletter. I send it out a little video or one of my previous videos. You can use it on social media. So you can send the same videos out to them. These are going to be pieces of the presentation. You can use it for a blog. So you take the same thing and you put that into a blog or multiple blogs about that book or about that video. You can use it for a book. This was the first idea that I had. My first renditions did not look like this. Okay, I don't want you guys to get what we call in the gap. Okay, the gap is where you like compare and you feel all bad about yourself. Like this is rendition number 10. The first one were really cheesy. And then I found someone on Fiverr that can do it super cheap. And I gave them a Google, just a doc. And then they just put images and they made it. And they kind of made them all look the same. And I put these there as well. Basically, all these are a transcription of me doing the presentation. And then with the pictures, with the same slides. So you guys can see them on my blog. So how do you get started? You can get all these presentations on Podiatry Practice Mastery. It's free for now, probably not free forever. I'm going to be turning that on soon. I'm not sure. There'll be maybe a portion that'll be free or a free trial or something like that. You can just join. Just click that little join button down there. Podiatrypracticemastery.com. That's where the address is. If you have any questions or ideas or thoughts or anything else, let me know down at Podiatry Practice Mastery. And I want to thank Cindy for this opportunity. I think it's kind of a mesh. With Cindy, I learned a lot of these ideas from her, seeing her speak. She was recently speaking somewhere, and she had this idea of the protocols, right? Visit 1, visit 2, visit 3. And I looked at hers because I'm part of her membership. And I was like, wow, those are great, but how can I include them into this? How can I include them into my presentations? And I included them. I'm not using them yet. So basically, it's always a work in progress. If you guys have any tips to make things better, please let me know. But thanks for watching. Have a great day.